Welcome to today's video. I'm Dr. Jessica, and we're diving deep into a topic that could literally save your life. Imagine being able to recognize the early signs of prostate cancer before it progresses, giving you a head start on treatment and a chance at a healthier life. In the next few minutes, we're going to uncover 10 critical early signs of prostate cancer that you need to know now. Whether you're directly affected or simply care about your loved ones, this information is vital. As we walk through these warning signs, remember that knowledge is power. Early detection can be the difference between effective treatment and a much tougher battle down the road. Before we begin, if you find value in health tips and empowering insights, please hit that like button and subscribe for more life-changing content. It's not just about clicking, it's about being part of a community that prioritizes health, prevention, and well-being. We're here to provide you with trusted information so that you can take proactive steps towards a healthier future. Now let's break down these signs starting from number 10 and working our way to the most critical warning sign at number 1. Each sign is explained in detail along with tips on what to do if you notice any of these symptoms. So grab a notepad and stay tuned as we guide you through these essential early indicators that could make all the difference in your health journey. Sign 10, changes in bowel habits. While prostate cancer primarily affects the urinary and reproductive systems, its location in the pelvis means it can also indirectly affect bowel function. You might notice a change in your regular bowel movements, such as constipation, straining, or a sense of incomplete evacuation. While these changes are often linked to dietary issues or aging, they can sometimes indicate pressure on the rectum from an enlarged prostate or nearby tumours. Persistent changes that last more than a few days and are not relieved by diet adjustments should be evaluated. Your doctor may recommend imaging or a digital rectal exam to assess prostate size and determine if further testing is needed. Sign 9, unexplained weight loss. At number 9, sudden or unintentional weight loss should raise a red flag. When your body starts shedding pounds without a change in diet or exercise, it may be signaling an internal issue. In the case of prostate cancer, cancerous cells can alter your metabolism and lead to a decrease in appetite or nutrient absorption. Weight loss accompanied by fatigue or loss of muscle mass should never be ignored. Document how much weight you've lost and over what period. This information helps your physician determine the severity and urgency of your symptoms. Sign 8, frequent urinary tract infections or difficulty urinating. At number 8, one of the early indicators you should pay attention to is experiencing frequent urinary tract infections or ongoing difficulty with urination. You might notice that infections seem to recur more often than usual, and that these episodes are accompanied by symptoms such as a burning sensation, cloudy or foul-smelling urine, or even discomfort in the lower abdomen. Additionally, you may experience a consistent feeling of needing to urinate but finding it challenging to do so. This could include straining during urination or only producing a weak stream despite having the urge. While these symptoms might initially seem like isolated issues, especially if they occur from time to time, their recurring nature could be a subtle hint that something isn't quite right with your prostate health. Paying close attention to these changes and noting their frequency and severity can be crucial. If you find that these urinary issues persist, it is important to consult with a healthcare provider to determine the underlying cause and take appropriate action early on. Sign 7, weak, interrupted urine flow. At number 7, another red flag to watch for is a change in the strength and continuity of your urine flow. Many people might brush off a temporary weak stream or minor interruptions as inconsequential, but when this change becomes a regular occurrence, it's a sign that warrants further investigation. You might notice that your urine flow becomes less forceful, or you might experience a stop-and-start pattern while urinating. This alteration in normal flow can indicate that there is an obstruction or inflammation affecting the urinary tract, potentially linked to prostate changes. Over time, these subtle shifts in how your body handles urination can develop into more pronounced difficulties. Tracking these changes, such as the amount of time it takes to empty your bladder or the consistency of your stream, can provide valuable information for your doctor. Addressing these symptoms early by seeking medical advice can help to pinpoint the cause before more serious issues develop. Sign 6. Increased urgency to urinate, especially at night. At number 6, experiencing a sudden and persistent increase in the urgency to urinate is another key sign that shouldn't be ignored, particularly when it disrupts your sleep. You might find yourself waking up several times during the night to use the bathroom, which can not only be a sign of underlying prostate issues, but also significantly affect the quality of your sleep and overall daily energy. This nocturnal urgency is often more noticeable because it interrupts a normally restful process, sleep, and can leave you feeling exhausted the following day. Beyond the disruption of your sleep cycle, the frequent urge to urinate can lead to other complications, such as dehydration or a constant feeling of discomfort throughout the day. It's important to observe whether this increased urgency is accompanied by any other symptoms like pain, discomfort, or changes in the colour of your urine. Keeping a log of these symptoms can help provide detailed information to your healthcare provider, allowing for an early diagnosis and timely intervention that may be critical in managing your health effectively. Sign 5. Blood in urine or semen. At number 5, the appearance of blood in your urine or semen is a critical warning sign that should never be taken lightly. This symptom can manifest as pink, red, or even brownish hues in your urine, or as unexpected traces of blood in your semen during ejaculation. While there can be various causes for this phenomenon, ranging from infections to kidney stones, when it appears in conjunction with other prostate-related symptoms, it raises an important red flag. It's essential to understand that the presence of blood indicates that there might be an underlying issue involving the prostate or surrounding tissues. This could be due to inflammation, an infection, or in more concerning cases, the early stages of prostate cancer. Even if the occurrence seems sporadic, it warrants a timely consultation with a healthcare provider who can carry out the necessary diagnostic tests to determine the cause. Paying close attention to this sign and noting how often it occurs and whether it is accompanied by any pain or discomfort can be crucial for early detection and treatment. Remember, early intervention is key, and addressing such symptoms promptly can make all the difference in preserving your long-term health. Sign 4. Pain or discomfort in the lower back, hips, or pelvis. At number 4, persistent pain or discomfort in the lower back, hips, or pelvic area can be an alarming signal. This isn't just occasional discomfort, it's a pain that seems to linger, sometimes intensifying over time. The pain may vary in intensity, ranging from a dull, constant ache to sharper, more distressing sensations that disrupt daily activities. For many men, this type of pain is easily mistaken for general aging or the result of a physically demanding day. However, when the pain becomes chronic or is accompanied by other symptoms, such as difficulty urinating or changes in urinary flow, it should be taken seriously as a potential early sign of prostate issues. The reason this symptom is so concerning is that the prostate is located in close proximity to these areas, and any inflammation or abnormal growth can result in referred pain. Keeping a detailed record of your discomfort, when it occurs, how long it lasts, and what activities might exacerbate it can provide invaluable information to your doctor. By recognizing and addressing these signals early, you can take proactive steps towards seeking the proper evaluation and ensuring that any underlying conditions are treated promptly and effectively. Sign 3. Erectile dysfunction. At number 3, erectile dysfunction, ED, emerges as a significant signal that can be intertwined with underlying prostate issues. While ED is a common condition with multiple possible causes, when it appears in conjunction with other urinary or pelvic symptoms, it may be an early warning sign that something is amiss with your prostate health. This condition isn't solely about sexual performance. It reflects underlying changes in blood flow, nerve function, or hormonal balance that can be associated with prostate inflammation or growths. You might experience a reduced ability to achieve or maintain an erection, or you might notice a diminished quality in your erections, which can understandably lead to frustration or concern. It's important to consider that changes in sexual function are sometimes the body's way of communicating that a deeper systemic issue needs attention. If you observe these changes, particularly if they develop suddenly or worsen over time, it is crucial to have an open and honest discussion with your healthcare provider. Detailed evaluations, including physical examinations and diagnostic tests, can help determine whether these symptoms are linked to prostate health or if there might be another contributing factor at play. Sign 2, unexplained pain or discomfort in the pelvic region. At number 2, unexplained pain or discomfort in the pelvic region stands out as a critical indicator to watch for. This type of pain is often persistent, meaning it doesn't go away with rest or common pain relievers, and it can affect your day-to-day activities. The discomfort may present as a dull ache or sharp stabbing sensations, and it might radiate to the lower back, hips, or even the upper thighs. Because the prostate is situated deep in the pelvic area, any abnormal changes in its structure, whether from inflammation, growth, or other pathological changes, can result in referred pain. This symptom is particularly concerning because it may be the first noticeable sign that prompts further investigation, even before other urinary or sexual issues become evident. The pain might be subtle at first, easily dismissed as minor strain or aging-related discomfort, but its persistence should not be ignored. Keeping a detailed record of the pain, noting its duration, intensity, and any activities that trigger or alleviate it can be instrumental for your healthcare provider in diagnosing the underlying cause. Sign 1, difficulty starting or stopping urination. Finally, the most critical sign to watch for is difficulty in starting or stopping the flow of urine. This can be incredibly frustrating and may also be one of the earliest signs of a developing issue with the prostate. Men might find themselves standing at the toilet, feeling the need to urinate, but struggling to initiate the flow. Conversely, once urination starts, it might become difficult to stop or control the stream, leading to dribbling or leakage. These issues are often linked to the prostate gland pressing against the urethra due to inflammation or enlargement, making it difficult for urine to pass smoothly. If you're experiencing this symptom, it's vital to seek medical attention promptly. Early treatment can prevent further complications and help preserve kidney and bladder function over time. Thank you for taking the time to watch and learn about these crucial early signs of prostate cancer. We hope this information empowers you to take charge of your health and seek professional advice when something doesn't feel right. Remember, early detection is key. It can make a significant difference in treatment options and overall well-being. If you found the insights in this video helpful, please consider showing your support by hitting the like button, subscribing for more health tips, and sharing this video with friends and family who might benefit from this information. Your engagement helps us reach more people with life-saving information. Take a moment now to reflect on what you've learned, and if you have any questions or personal experiences to share, feel free to leave a comment below. Staying informed and proactive is the best step towards a healthier future. Until next time, stay vigilant, take care of yourself, and remember that your health is your greatest asset.